Hey guys, my name is Ronald. I'm a registered nurse and also a family nurse practitioner. Welcome to my channel, Nurse Track 101, where nursing lectures are made easy just for you. Well, let's get started. Now we're going to talk about the signs and symptoms of diabetes mellitus. I use this slide because it would illustrate you what happens with somebody who has hyperglycemia or somebody with really high concentration of blood sugar. I rarely see this happen. I can probably see this happen when somebody goes to probably ER doctors see this happen often, because this usually does not happen when your blood sugar, even if it's 200, 300, it depends on the individual, but if it's 200, 300, 400, usually this one will not happen. I don't see this happen unless if you have severe hyperglycemia or severe high blood sugar, then this usually doesn't happen. The first one, what happens is that it's called polyuria. This is the classic symptoms of diabetes mellitus or severe hyperglycemia. It's called this is the name right here, polyuria. This is when you pee a lot. This is increased urine excretion. So what happens in the body is that as you have high concentration of blood glucose, some of them will spill, a lot of them will spill in the urine. So you have increase of glucose in the urine. Since the urine becomes hyperosmosis, glucose will attract water. So you will attract water. Then you're gonna have increased urine production, and this one will lead to, of course, polydipsia. I'm gonna say polydipsia. In this case, because you excrete a lot of urine, then you're gonna become thirsty. You will drink a lot. And the third one will be polyphagia. Here you have an increase in blood glucose, but either your cells cannot use the glucose. So your cells cannot use the glucose, and the cells will tell the brain, I'm hungry. Even though you have high concentration, you have severe hyperglycemia, your brain will tell you that, oh man, I'm still hungry. I'm hungry, because you don't get enough food in your cells. And that's the classic symptoms of hyperglycemia or diabetes mellitus. And I just want to tell you, this only happens when it's very severe. And this is some of the signs and symptoms of diabetes mellitus. Always tired. You feel tired because of the high concentration of blood sugar. You're getting fatigued because you don't get enough food. And even though you have high concentration of blood sugar in your bloodstream. The second one is polyuria. I've mentioned it. I talked about it earlier. Frequent urination, increased urination. Sudden weight loss. Sudden weight loss is mostly because of, your cells do not get enough food. Your cells do not get enough nutrition. Also, because of your body cannot use sugar, then the body will start breaking down muscles, proteins into amino acids, and also fat as a food source. Wounds that won't heal, and this usually happens because increased or severe hyperglycemia will pretty much destroy your vascularizations or make your circulation, especially in the peripheral, in the feet or arms, become more damaged. As a result, there's not enough blood circulation, so wounds will not heal as fast as they used to. Sexual problems. This is because of bad circulation. The diabetes will cause bad circulation, as you know, like in genital, for example, penis, you need a good circulation in the penile artery. The next one is polyphagia. This is I explained it earlier. And this one is blurry vision, because this is a change in concentration of water in the lens of the eyes. That's what causes blurry vision. Numb, tingling hands or feet. This is a peripheral nerves getting irritated because of the high concentration of blood sugar. Polydipsia, I talked about it earlier, and this is vaginal infection. This is because as you excrete more sugar in your urine, this will lead to vaginal infection, fungal vaginal infection. In men, it's called balanitis, fungal balanitis. And I see this very common in uncontrolled diabetic patients. So right now, I'm going to talk briefly about some common diabetes treatments. As you see this one, there's it depends on the severity. There's a guideline and the recommendations that we use as providers. But also it depends on how you interact with the patient, how the patients want to go about it. Even though you want to prescribe, you want to be aggressive with your treatment, but if the patient refuses, it's impossible to do it. I usually start with this one: diet and exercise, of course. Usually type 1 diabetes you can't manage with diet and exercise because they don't have insulin or lack of insulin. And usually I start patients with type 2 diabetes, I will start with diet and exercise. I would suggest do a little bit, even any kind of exercise is good for the patient. But I would suggest like do a little bit of weight training to increase the muscle mass, so you can increase the surface area of the receptors. Diet, mostly plant-based. Try not to eat too much simple sugar like sodas, things that will make your blood sugar go high significantly. I mean, if you want to eat carbs, try to do complex carbs. And like I said, plant-based, mostly plant-based diet. And the second one is oral meds. This is oral medications. There are several of them. And this is the second treatment. And the third one will be insulin. All people with type 1 need insulin, whether it's a long-term insulin, short-term insulin, intermediate insulin. And only type 2, usually type 2 will start with oral medications if they need. And then it depends on the severity, then they will end up having insulin. And usually I don't prescribe, people with diabetes want to have this one, home glucometer. It's important to have it, but it's not really necessary for somebody who was on oral medication. I'm going to talk about the oral medications and the insulin more in more details in the next few videos. So thank you for listening, guys. And if you have any questions, email me or put it in the comment section. This is one of the most exciting topics because a lot of people have this, and if you can help patients with diabetes to improve their lives, improve their quality of life, it's gonna be awesome. It's gonna be worth it. Thank you guys for watching, and I hope you enjoy this video. I also do hope that this video will help you in your studies to pursue a career in nursing. If you guys have a request about any other topics in nursing, leave a comment below. And if you guys share or like this video or subscribe to my channel, it will help me tremendously to create more of these videos. Well, I'll see you guys till next time. Bye.